And general impression of the patient?
Patient is in obvious distress. He is clutching his chest. He's bent over. His skin is pale, cool, and diaphoretic. That's what you see.
Okay. How you doing, sir? My name is Nick with the EMS service. I understand you're having chest pain. Is that correct?
Yes.
Okay. Let's see. So he does have airway because he is answering me.
Okay.
He is breathing.
Airway's pain.
At this point, I'm going to go ahead and listen to his lung sounds. What am I hearing?
Lungs are clear, equal bilateral.
Good. And rates per, or breaths per minute?
24.
All right. And we're going to go ahead and check his pulse, and his pulse is?
Pulse is 110 a minute.
And how is it feeling?
Feels a little thready and irregular, slightly irregular.
You said 110, I'm sorry?
Yes, 110.
And let's see, we're going to go ahead and take his blood pressure.
Blood pressure is 172 over 92.
Alright. Alright, so at this point I am going to, we're going to get his treatment and then we're going to rapid transport.
Excellent.
So, Mike, let's see, how long has this been going, or let me see. So, you have chest pain, correct? And where's it hurting at in your chest? Can you point directly at it, or is there?
Patient describes the pain, center of his chest, and kind of hints that it's moving along his left arm as well.
On the left arm? Alright, and let's see. Are you allergic to anything, Mike?
Mike tells you he's allergic to penicillin.
And let's see, do you take any medicine?
He tells you he takes lisinopril, atenolol, nitroglycerin as needed, and aspirin once a day.
Repeat the second one for me. Lisinopril, atenolol?
Atenolol.
I think you need bigger hands.
Yeah, I do. Alright, and let's see. What's your past medical history? Anything similar to this in the past, or?
Just about a year ago, he experienced a similar episode. He was taken to the hospital. They said he had a mild heart attack, and he was. They had to put a couple stents in.
Alright, and let's see. When's the last time you ate?
This morning.
This morning. And the last time you took your medication?
This morning, tells you.
And let's see here. And what were you doing when the pain came on?
Watching my hot wife bend over.
They're peevers.
Patient was doing the dishes.
Roasting your husband? And
She's not supposed to know about that.
so you were doing your dishes when this came on. Let's see. Does anything make it better or worse?
Patient says that when he stands up and walks around, the pain gets a little bit worse, and if he sits down, it subsides slightly.
Let's see. Is it crushing, or is it sharp, or it feels like somebody poking you, or how does it feel?
Patient says it is feels like somebody's sitting on his chest. It's very dull and crushing in nature.
And does it radiate anywhere? Does it
Left arm.
just the left arm? Okay. And let's see. What would you rate it at on a scale from 1 to 10, 10 being the worst pain you've ever had?
10.
It's a 10. And let's see, how long has it been going on?
Patient says it's been going about 40 minutes now. He thought it would go away on its own, but it hasn't.
Okay. Alright, so at this time I'm going to go ahead and contact medical control. Medical control, unit 1, this is Nick. I have a 60-year-old male complaining of chest pain. He has a history of heart attack about a year ago. They do have him on lisinopril, nitroglycerin, atenolol, and aspirin once a day. His blood pressure 172 over 92. Respiratory rate is 24 and equal bilaterally. pulse rate is 110 and irregular. Permission to administer up to 3 nitroglycerin and 324 milligrams of aspirin.
Okay, when was the last time you had aspirin?
This morning.
That sounds great, go ahead and give him that, go ahead and call me if you have any questions or if you need anything else.
Alright, so we are going to give you some aspirin. I've got these 4 baby aspirin. Why don't you go ahead and put these in your mouth and chew them up for me? And then once you get that, I'm going to go ahead and put this nitroglycerin tablet underneath your tongue, okay?
Okay.
Alright, so let me put that in there. And while we're doing that, I'm going to get you on 15 liters of oxygen via non-rebreather mask. I'm going to set this on your face, okay?
Okay.
And I'm going to reassess his pain in about 3 to 5 minutes, just to see how it is.
Patient tells you after 1 nitro and aspirin on reassessment his pain is at an 8 on 10.
Okay.
And blood pressure is now 155 over 90, and heart rate is about 108 a minute.
Alright. So Mike, what we're going to do is we're going to give you another nitro. Just go ahead and remove the mask. We're going to put this into there. And again, after 3 to 5 minutes, I'll reassess his pain. While we're waiting for that to come into effect, you already gave me the vitals, I'm sorry.
You give another set though, right?
Yeah.
Okay. And you were going to continue to do that process, correct?
Yes. I
How
do
often
that
would you
every 5
reassess
minutes.
vitals?
Every 5 minutes.
5 minutes, good. And what you would also want to reassess what?
His pain.
Good. Focus assessment, awesome, good job.
What was his last pain level?
Whatever, I just keep going until you're out.
Alright.
Good
So
job.
then we would load.
Excellent job.